Hey guys, what's up? It's Dr. Dylan Greeny, and I'm here with you doing a skincare live. We love answering all your questions, so I'm going to be here literally answering every question you guys got on skincare. And I want to help you get your best skin. I want to do things that are affordable, simple, safe, and effective. Make it very easy for you to get over the counter from your drugstore. So any questions you got, feel free to drop them in the comments. I'm here for you. We got a wonderful thing. If you're not about asking questions, the good news is we're going to be able to you'll learn a ton from just hanging out in the live chat. So thank you for being here again, and we'll get this rolling. So thank you, really appreciate you guys being here. So tretinoin is only by prescription, right? So yes, tretinoin is the type of acne medicine, but it's also approved for anti-aging. It also works for anti-aging, I should say, for fine lines, wrinkles, dark spots. It helps stimulate collagen, help to thin out dull, dead, dry skin. And it's wonderful. It is available by prescription only, but you can get some other retinoids over the counter like adapalene without a prescription. So the La Roche-Posay Effaclar adapalene gel is one of my favorite. Best diet for the skin, it's hard to say. I mean, I don't know if there's a perfect diet for skin in general, but I would definitely recommend, a well-balanced diet, generally low in saturated fats and high glycemic index foods. You want to eat complex carbohydrates rather than just like plain sugars. My nurses do all the biologic prior auths? Yes, my nurses do, and we also have a biologics nurse that does that specifically. Why are the lips dry? Always, I'll tell you what, it's really hard time right now in the winter months. The heat's on in the house, humidity is lower, the lips are definitely going to be drier overall. So I think that's part of what's going on. But Vaseline, Eucerin, Aquaphor, Remedy for Dry Lips, those are all good products to help your lips not be so dry. Tips for folliculitis. So for those of you guys that don't know what folliculitis is, there's a lot of different types of it. You can have fungal folliculitis, but far more commonly, the main issue that people have is having bacterial folliculitis. So I really like using a cleanser called CLN cleanser. It's a type of antimicrobial cleanser that's very gentle. It's approved for even children and people with eczema. So you can use that all over your body, and that's a really good way to help reduce those issues. So best psoriasis shampoo and body lotion. Psoriasis is very frustrating. It kind of almost looks like dandruff when it's on the scalp, and the scalp is a really hard area to treat. But Neutrogena T Gel and Neutrogena T Sal is very good. Another thing that should also be considered is there's a new shampoo by Vichy called Durkos. And that can actually help reduce some of the Malassezia yeast that is kind of part of the problem when it comes to scalp dandruff and seborrheic dermatitis, psoriasis. So I'd look into that. Active toners for congested skin. You're pretty much going to want to look for acid-based toners. So things like doing, you're going to want to look at things like doing the alpha hydroxy acids like glycolic acid and beta hydroxy acids like salicylic acid. So these are some of the best things that you can do overall. I would look into doing those. So I'm just going to get on here real quick. Pull this up here. Make sure this is all good too. So good toners. Paula's Choice makes some really good ones. So Paula's Choice is a really nice option for this that you can do. I want to encourage you guys, make sure to drop any comments that you have in the chat. I'm here for you guys. I want to help you guys. That's the whole reason I do this. So drop the questions in the chat. If you guys are here, it really helps to tap the live. If you got friends that love skincare, make sure to share the live with them, because I'm going to be here hanging out with you guys for a while. We're just getting started. So I'd like to help everybody get their best skin. Fortunately, I've been able to help literally hundreds of thousands of people get their best skin on social media. So make sure to invite them to the live. Don't gatekeep, as they say. So don't gatekeep. So I hope you guys are having a great weekend, by the way. And I'm Ashar. Thank you. I want to say thanks for joining. Wonderful subscriber, Ashar. It's good to see you here. So thank you. I see a lot of questions about broken capillaries. So broken capillaries on the skin are very frustrating. Part of it can be caused by sun damage, but also people that have trouble with rosacea can have issues with broken capillaries. So broken capillaries are the little tiny blood vessels that are in the face that can contribute to redness. Almost everybody has some of them around the corners of their nose, but a lot of times you'll see it on the cheeks from sun damage. So that's one of the reasons it's so important to protect your skin from the sun, because the more sun damage you get, the more likely you are to have those broken capillaries. So the great way to treat them, really the only way to treat them, is with laser. There's a lot of different lasers you can do. like KTP or PDL or BBL. I have a lot of people that I treat with, redness is a very common concern that I see every day. Neutrogena Collagen Bank, the new one released, I think it's wonderful. It's a wonderful moisturizer. It says my skin is glowing. Well, thank you so much. I really appreciate it. Comment on beef tallow. I'm not about it. I think there are better formulated products to use for some moisturizing your skin. So I'm not really a big fan of beef tallow. Probably the most common question I get on social media is about beef tallow. Best OTCs for psoriasis. There's not a lot. I mean, you really do need prescription treatment when it comes to psoriasis because there are steroid creams are pretty much like the mainstay treatment for psoriasis, but there are steroid free options now available. And then the list goes on and on for options for treatment of psoriasis. Now there are a lot of steroid free pills. There are injectables that can clear the skin nearly 100%. Zoryve, as Hunter says, is a really, really nice option. Phenol peels are fairly uncommon. There's not too many people that like effectively know how to do them, but they can be incredible. The downtime's pretty high, but like I tell any of my patients, and 50% of what I do is cosmetic. I'm a cosmetic dermatologist 50% of the time. I do general dermatology and surgery the rest of the time. So I do a lot of this stuff, and the type of peels I do are very light, but phenol peels are incredibly aggressive. They're actually quite similar to my fully ablative laser resurfacing cases that I do with erbium. And they can make incredible results. They can literally take a decade off your skin, but they're dangerous. So the thing is, you have to be monitored. They're very dangerous, and there's a lot of downtime. So thoughts on the brand PCA. So PCA is an incredible brand. It's one of my favorite brands. In fact, they make some incredible chemical peels on that topic. They're very good in there. They're owned by the same company that owns EltaMD. And if you guys know EltaMD, you know it's one of the most respected brands in all of dermatology. Probably make literally the top 3 sunscreens ever made. I mean, it's literally the product that I bought more than any other skincare product is EltaMD UV Clear Tinted. Tacrolimus is a great steroid-free option. So I really, really like tacrolimus. I would encourage you guys, especially on YouTube, if you're on YouTube, drop some questions in the chat or just drop a thumbs up. Let me know you're here. Drop a like in there. I want to help you guys get your best skin. So if you're on YouTube, I'd love for you guys to just ask a skincare question, drop something in the chat. I want to do more on YouTube, but I just want to make sure you guys like it's helping you. So any questions you got, I want you to know you're here. If you're on TikTok right now and you're not getting your questions answered, feel free to, you can pop over to YouTube. The chat is a little slower over there, so I'll make sure to see it. I'm doing really good today. Not a dermatologist. Thanks for being here. I appreciate it. It's good to see a familiar face. So OTC anti-aging recommendation for someone starting off. So Myra, who's an RN, by the way. So thank you. I was actually a nurse before I was a dermatologist. So let's talk through the best like anti-aging glowing skincare routine that anybody can do. Doesn't matter if you're 20, doesn't matter if you're 50. I'm going to walk you through a perfect routine right now. Hearts by Hearts, good to see you. Thanks, Kim, for coming over from TikTok, by the way. Test the Spirits, thanks for being here. And Yenny, estrogen for the face, what we'll say for that is it is growing and getting interesting on estrogen. The trouble is getting in the skin, but we know as estrogen falls off, particularly after menopause, that your skin ages quite quickly. So that is an issue that you have. Kim also says, how do we tackle post-inflammatory hyperpigmentation? It's hard. I would say there's literally hands down the best treatment that's on the market right now for post-inflammatory hyperpigmentation is one called Remedy for Dark Spots. It's made by Dr. Manib Shah. It has 9 active ingredients for fighting hyperpigmentation. So everything that you hear dermatologists talk about as a way of helping hyperpigmentation, literally this treatment has all of those in it that are stabilized. So if you're going to spend money on something for dark spots and you're not getting laser, or you're not getting medical procedures for that, then Remedy for Dark Spots is the solution. So, and Munoz says, hi, I'm from CT. I'm also an RN. Awesome. So thank you so much for being here. Looks like we got a couple RNs in the chat. So it is a great discussion. You guys have answered some or asked some great questions already today. So I really appreciate you guys being here. Damo, best treatment for acne related ingrown hairs. So always keep in mind, if you have hair in areas where you don't want it, you could get laser hair removal. Laser hair removal is a wonderful way to reduce that like follicular burden that you're having and getting those ingrowns. Otherwise, your best bet You could try things like depilatory creams, like Nair is a good option for helping with those ingrowns as well. Other options that you can do is make sure you're washing with like a mild antibacterial cleanser like CLN and decrease that bacterial burden. Because if you decrease that bacterial burden, you know, sometimes that little bit of extra bacteria that's on the skin, the issue is that is what's causing some of that inflammation. Remember, the closer you shave, the more likely you are to get ingrowns. And then some of my patients with darker skin types tend to have a different chemical composition and bonding within their hair, which makes it more kinky curly. And those kinky curly hairs are a little bit more likely to grow into the skin. So I'm going to get to you guys questions. I do want to talk about a good anti-aging routine, because this is the thing that can help people the absolute most. Okay. And I'll start by saying this. And it's not that I care about getting like a few clicks for making a few pennies for selling the products, but if you guys don't catch it all, if you do click the link in my bio and you go to my shop, I literally have the skincare routine there. So you don't need to trip. You don't need to worry if you don't get it, but I'm going to walk you through and I'm going to explain why this is important. If you guys want to have the best skin in your life, what you guys want to do, I'm going to do morning, I'm going to do night. And this is very important. So focus up on this. So you want to cleanse twice a day. Okay. And I think there are some great cleansers out there. There are two that really, really come to mind. The CeraVe cream to foam cleanser. I like that because it's going to lather. It's going to leave you feeling clean. It's going to wash away makeup and tinted sunscreen. Okay. So that can be used morning and night. It's not an active cleanser. It doesn't have actives in it. It's not anti-aging, but it gets all that dirt, gunk, oil, grime off your skin, tinted sunscreen, makeup. It's awesome. So for the people that are worried about double cleansing, you can really just use that one and be good. So that is a great option for cleansing in the morning. The second most important thing you can do in the morning is you want to apply a vitamin C serum. And a lot of people have been asking about vitamin C serum this morning. It's one of the most important things that you can do, because vitamin C serves as a powerful antioxidant, and it combines very nicely with the next step I'm going to tell you about in protecting your skin. So vitamin C itself is a cofactor in forming collagen. So that's a part of it. But also, being that it's an antioxidant, it can also help to reduce inflammation in the skin. It can reduce the damage from UV radiation as well. And they've studied this along with the sunscreen, which we'll talk about next. Now, the CeraVe Cream to Foam Cleanser is a great one. The Rock Barrier Renew Gel to Foam Cleanser is very good. As far as vitamin C serums, there are two that are really, really top notch. The first one I'll tell you is Brandify, Brandefy, Brandify vitamin C. It's incredible. It's 15% L-ascorbic acid. It's got ferulic acid, and it's wonderful. So that one's very good. Another really great one is Vichy, V-I-C-H-Y. That's the vitamin C you guys want to be doing. You want to put it on right after cleansing. Then you're going to follow it up with a sunscreen. Now you want to use a tinted sunscreen, and I really recommend using a hybrid. So you want part chemical based and you want part physical based. So I like personally the Ulta MD UV Clear Tinted. Very, very good. So that one's very good. Or you could use the Peter Thomas Roth Water Drench Tinted Sunscreen. These are incredible. So that's going to be by far your best sunscreens that you guys can use. It is fantastic. Now that's going to be pretty much your entire morning routine. If you tend to have dry skin, you can also add in a great moisturizer if you want, something like CeraVe. It doesn't need to be anything expensive, but that's good. Why tinted? That's a great question. You want to use a tinted sunscreen for a couple reasons. Sometimes when you use a non-tinted sunscreen, you can get a little bit of that white cast, which dulls your skin. Nobody likes that. You look a little ghostly. Definitely don't think it's a good look. Tinted sunscreen also is going to cover up minor imperfections. I have a tinted sunscreen on right now. I actually have the Peter Thomas Roth Water Drench Tinted. I love it. It's going to leave you glowing too. So when you put it on, it just complements your already great sunscreen and your already great skincare and skin. So, and it also helps protect against blue light exposure. So blue light from lights from screens, but more importantly, blue light from the sun. The sun itself actually is the biggest producer of UV rays, but also from blue light. So that's the morning routine. That is the most important way to get your best skin in the morning. Now I'm going to go through, I'm going to answer some questions over here too. So I want to answer these guys. So the questions are, and listening and running on errands. So how do we tackle dark spots? We got that. Best treatment for acne and ingrown hairs. We got that. So Carly is goat. I have eczema, 4 spots, cortisone clears 3 of them. I have a big eczema rash that I've had for 10 years that will not go away. Any advice? So for people that are struggling with eczema, so eczema is very frustrating. It's a condition that's usually treated with topical steroids. You got to keep in mind, hydrocortisone is one of the mildest topical steroids. Sometimes eczema can be very, very frustrating. So things that come to mind here, you want to make sure, one, you have an accurate diagnosis. So if you have a lot of different rashes on your body, you want to make sure to see a dermatologist. Make sure that it truly is eczema. Could it be something else? Could it be a fungal infection? Could it be psoriasis? It could be something really rare like mycosis fungoides. It's important to see a dermatologist to get that diagnosed. We can obviously give people much stronger steroids that can treat more stubborn eczema spots or psoriasis spots. So I'd see a dermatologist. Make sure you're moisturizing very effectively. That's the most important thing you can do. Last year, a dermatologist did cry on my face without warning me of hypopigmentation. How can I regain the pigmentation in my face? So Margot, this is a very important thing and a side effect definitely of cryosurgery. Now let's get into this a little bit. And Margot, give me a thumbs up if you're still here in the chat, by the way. So cryosurgery is a type of treatment that we do to treat things like age spots, more importantly, precancerous skin cells, warts. Now, if you have darker skin types, then the issue is our melanocytes that make the color of our skin, they are way more likely to die from cold exposure than our normal skin cells or like precancerous skin cells. So it only takes -5 degrees Celsius to kill melanocytes. So that's what happens. Now, getting pigmentation to come back is actually very, very challenging to get pigmentation to come back. So really the best way pretty much studied to do that is doing something like Latisse, Bernatoprost, Latisse with microneedling. For whatever reason, that does stimulate the melanocytes to make color, but I will say one of the hardest things to treat is to treat a hypopigmented scar. There's not a lot of great ways to get it back. Can you speak about NAD+? I'm not really the best expert on that, to be honest, Kim. I know it's becoming pretty popular in the anti-aging world and longevity world. But I don't know that I could, really weigh in on that and make it, make a huge difference for you there. How to get rid of contact dermatitis on the lips. So Daphne, by far the most important thing if you guys are dealing with contact dermatitis is you got to it's contact, right? It's an allergic contact dermatitis. It only takes a tiny amount of that exposure to stimulate rash and irritation. And sometimes even if you have that exposure only once every 4 to 6 weeks, you can keep the rash going. So by far the most important thing is identifying the contact allergen and then avoiding it. So nowadays it's very easy to generate lists based on your contact exposure. And then once you can avoid the allergen, then you've cured the problem. How can I get rid of acne on the jawline? So Cat's World, the most common thing on the jawline in the Cat's World, I don't know if you're a guy or a girl, but for women, hormonal acne on the jawline is very stubborn. That acne that shows up when you're in your late 20s or early 30s, and you feel like, man, I should be out of this acne, and now you're dealing with acne on the jawline. It flares with your menstrual cycles. One of the best treatments ever is something called spirulactone. So spirulactone is something that can definitely help that. It helps most people, but you also want to do a great acne routine on top of it. You want to be using something like a 4% benzoyl peroxide cleanser in the morning and adapalene at bedtime as well, or other prescription retinoids. I want to say for a second, I want to kind of reintroduce myself again. I'm Dr. Dylan Greeny. I'm a board certified dermatologist. I'm here to help you get your best skin. I love answering you guys' skincare questions. I want you guys to tap the likes, guys. If this is helping you, please keep tapping that screen, man. I want you guys to do that because it fuels the live up. It helps more people reach this platform and help get their best skin. So thank you guys for doing that. If you guys have friends, make sure to invite them to the live. We're just kind of getting started with this. So feel free to, invite them to the live too, because I want to help them as well. Let's see here. So I think I'm probably the most accessible dermatologist on social media. I love interacting with you guys, and I think that's one thing that makes me very different from everybody else on social. I'm here for you guys. I answer all of your questions, and I appreciate your guys' support on the channel. So if you guys don't subscribe and you don't follow, feel free to subscribe. Thanks for interacting in the chat. Thanks for the lives. Thanks for the supers and the stickers on YouTube. It really helps grow the platform. So I appreciate you guys. Thank you. And the subscribers, I'm obviously incredibly grateful for. So thank you guys so much. So how about skin? Muno says, how about SkinCeuticals C Frulic What are your thoughts about it? So it's one of the best vitamin C's that there are, but the reality is it's pretty expensive. So that's the trouble with it. It is an expensive one. It's incredibly good. It gets a lot of criticism for not smelling great. And I think that's something we all know. But like for me, I don't care what it smells like as long as it works. How to get rid of contact dermatitis. So we talked about that. Apex, I have little bumps on my face and they're not going away a long time. What should I do? So Apex, there's a lot of things that can cause little bumps. Sometimes it's oil glands, sometimes it's acne, sometimes it's rosacea, sometimes it's milia. Go to your dermatologist and get that checked out and figure out what's going on with that. Again, for those of you guys that are looking for the best acne routine, if you don't catch it right now, it is in the link in my bio. If you click the link in my bio, you can go through Amazon, you can go through Shop My. I have my favorite acne routine there. It's very simple, very affordable, but I'll go through it with you guys now. If you guys are struggling with acne, the best thing that you guys can do is in the morning, you can use a 4% benzoyl peroxide cleanser. I like the CeraVe one, or you can use a Panoxyl 4 or 5% in the morning. And then at bedtime, you want to use an adapalene on the face. So different adapalene or La Roche-Posay adapalene. Those two things right there will improve nearly all acne somewhat. Now, I'm not saying that every acne routine is going to do like amazing with that. I'm not going to say that every single, acne is going to get better with that, but it's going to help most people. So some people are going to need oral antibiotics. They're going to need stronger things. They're going to need Accutane. They can need any of these things, but that's a great starter routine for people for sure. Is it bad to use 0.05 tret without a prescription for dark marks? So tretinoin is one of the best things that there are for dark marks and for acne. So, but it is a good idea to, make sure, if you're using tretinoin, it's not something you want to be using if you're actively trying to conceive. It's argued if you should be using it while you're breastfeeding, but I would talk to your doctor about that. Is a Dermaphor and Aquaphor the same? If not, what you recommend? So I actually I love Vaseline more than either. Aquaphor does have lanolin in it, which is an allergen, and sometimes can block pores. But I like Vaseline, but Aquaphor is a wonderful, wonderful treatment overall. Anything I do for redness from sunburn exposure on the face that never went back to normal. Sean, you can do treatments like laser treatments for that. That's the best way to do it. So PDL or BBL, those things are good. Tatiana, what is your question? I am answering the questions. What should I use for dehydrated lips? So Vaseline is very good. What to do for psoriasis on the scalp? Prescription treatments like strong steroid solutions are really good. If you're trying to minimize pores, another good option, Myra, is doing remedy for pore size is a good one. You can also do your adapalene. The skincare routines that I'm talking about are going to help across the board. It's going to help across the board. If you're doing the things I talk about, it's going to help pores. It's going to help fine lines and wrinkles. It's going to help dark spots. It's going to help all of that. Dust mites can definitely flare eczema for sure. Unfortunately, kind of hard thing to tackle, changing your sheets, rotating your mattress, using HEPA filters in the house can help. But a lot of people that do have eczema do have kind of that allergic skin, they can't have environmental allergens like dust mites, so they can definitely flare that things. Keratosis pilaris on the face, I would lean into the amlactin lotion. How do you know if skin is dry from kidneys versus eczema? So it's kind of two different things. I mean, eczema tends to affect, in adults, it can come up patchy kind of anywhere on the body. But when you're younger, a lot of times it's behind the legs, in the pits of the arms kind of thing, like here, But if your kidney function is pretty down, it's not necessarily that you'll have dry skin, but you can have itchy skin. Fungal acne, one of the best treatments I like for fungal acne is I really, really like Scrub MD soap. That's a very good option for sure. So dark knees and elbows, I really like that. That's something we talked about a lot in a recent video, but for that, I would do the gentle exfoliating acids like amlactin, like CeraVe SA lotion. You could even use the First Aid Beauty KP Bump Eraser, but you got to be a little careful scrubbing too much, because sometimes if you over scrub the skin, you can get something called lichenification, which is the thickening of the skin that can lead from darkness. Apex says, I get tanned even if I'm wearing sunscreen the moment I go out. Can you help? So yes. So Apex, one thing you can do is you can actually try, there's two things that are out there. There's something called sun powder, and then there's another one called HelioCare. If you prefer taking a supplement that you mix into a drink, you could use sun powder. If you prefer taking a capsule, then you could use HelioCare. But that has been shown to decrease tanning if you take it. and it's a thing called polypodium that's in there. So you can kind of look into that if you want. That's a really, really nice option for reducing tanning. So you do want to apply your sunscreen. You want to use at least an SPF 50, and you want to reapply it every 2 hours. Dark spots on the cheek, yet again, one of the best things that you can do for dark spots on the cheeks is Remedy for dark spots. So I would definitely check that out. Get a breath here. So let's see. 26, only get acne on the jawline. Is it hormonal? Most likely there's a big hormonal component. The acne on the jawline is incredibly frustrating overall. And if flaring, especially during your periods, then things like spironolactone or Winlevi, those things can kind of help. So how to control Demodex. So ivermectin is a prescription problem that you can use for Demodex mites. For those of you guys who don't know what Demodex are, this is things of nightmares. We all have trouble with, with these mites that live on all of our skin. It's kind of crazy, but we have a lot of bacteria on our skin, and we also have these little mites called Demodex. Now, people that are prone to rosacea can actually flare up from these mites being on the skin. And there's a prescription treatment called ivermectin that can help. Potentially another thing that you can do over the counter is you could do things like sulfur-based cleansers. So sulfur-based cleansers can definitely help that as well. So that's something else you can look into to help control Demodex. So Munez says, for tretinoin used to, I need to rest or stop using after being used for a certain period of time. Is there a resting period for it? No. So tretinoin, the key is if you're trying to start tretinoin, you want to use just a pea-sized amount, and you want to treat your whole skin. So you just want to take that pea-sized amount, dot it together, dot it all over your whole face, and rub that in. You can apply a moisturizer afterwards. But tretinoin actually should be used as consistently as possible. If you can use it and tolerate it every night, that's actually the best way to use tretinoin, because tretinoin is a bit of a marathon. It's like the people that use it over their whole life, they just do better and better. And it helps with wrinkles, dark spots, acne, anti-aging, and boost collagen. So there's a lot of great reasons to do it. So Linda, my scalp is itchy beyond belief. Help. So Linda, it's very frustrating, and it's a very common problem to have itchy scalp. I don't know if you have flaking. If you have any flaking or dandruff type symptoms, then I would look at like the Vichy Durcos shampoo. I'd be using that at least a couple times a week. Do that. A lot of people worry, they're like, oh, my scalp's dry, so they don't shower and they don't wash their hair as much. I would definitely make sure you're washing your scalp every day. Make sure to see your dermatologist, because there's a lot of other conditions. Even sometimes nerve damage in the back of your neck can cause that. Nerve damage can cause itching on the scalp, and there's other conditions that are more serious that can cause itching scalp. So a lot of different things can do it. Thinning hair problem. So thinning hair is a very common concern that dermatologists see. In fact, dermatologists see 3,000 conditions of the hair, skin, and nails. So if you're having trouble with your hair, the dermatologist is the right person to see. Part of hair thinning is getting an accurate diagnosis, because you can have all over hair thinning that's more like part of aging and hormones. You can get hair thinning from conditions like PCOS. You can get hair thinning from inflammatory conditions that can cause scarring. And hey, Rossi, I gotta shout you out, Rossi. Thank you so much. You're dropping like an incredible amount of those in the chat. So thank you, Rossi. You're amazing. Thank you, thank you. So over the counter, one of the best ways to kind of help treat hair thinning that's pretty much safe for nearly anybody is doing minoxidil. So you can get a 5% minoxidil and do it once or twice a day. Doesn't matter if it's the foam. Minoxidil is the same thing as Rogaine. So for the people asking about Rogaine, minoxidil, Rogaine, 5%. Don't get caught up in the men or women's thing. If you're doing it, that's kind of just marketing more than anything. The 5% overall is shown to be more beneficial. Does semaglutide cause acne breakouts? I feel like I've heard the mix of both things. I've heard some people get acne better. That's not a super common thing. but semaglutide, obviously helping a lot of people lose weight overall. But I don't know about acne breakouts, if that's something that's super proven. Is LED therapy really work for hair thinning and hair loss like eye restore? So Munoz, I actually personally use eye restore, and it does help. When you look at things like oral minoxidil, finasteride, topical Rogaine, all of these things have really good evidence for being effective. And when you put all the studies together for hair loss, low level light therapy or laser therapy for the head, like eye restore, does help. Is it the first line treatment? Maybe not. For some people, it will be the first line treatment because they don't want to take a medicine, or they don't want to risk side effects from a medicine. So for those reasons, it can be very helpful. Now, I use eye restore 3 nights a week, 25 minutes when I use it. So I like that a lot. So eye restore can be beneficial. I like it as the cherry on top of other things, but but yeah. Yep. So yeah, so let's see. Can I use minoxidil at 17 years old? Technically, yes. I mean, really, topical minoxidil, the only real worries that you have with topical minoxidil is really excess hair growth. Do you lay down on your pillow and get a little bit of that like wet minoxidil on your ears, or do you lay it on the side of your face? So the trouble is you can get a little bit extra hair growth where you don't want it. Rishi says, I have squint eyes. How can I cure it? So I don't know exactly what your question is, but sometimes people's eyes get heavy here, and we can do different treatments. We can do different treatments like blepharoplasties to remove some of the excess skin on the upper eyelids, and that can help the eyes appear more open. I'll try to show you guys a good picture here of like one of my nurses. So on this gal here, like I did a blepharoplasty. I don't know if that's focused, but you can see how much more her eyes are open in the second photo. So that's a simple procedure that you can do. Now, sometimes things like Botox can actually really help to also open the eyes, particularly if you do the Botox between the eyes and around the eyes. That's a good way to help open the eyes up. If you treat the forehead, it's only going to make your eyebrows feel a little heavier. So if you're looking for the biggest pop of your eyes, you want to treat like below the eyes, around the eyes, and treat the glabella. Because if you imagine, this pulls your eyes down and in, and these muscles around your eyes squint. So if you treat those, it relatively makes your eyes feel more open. So will using a red light panel make a difference in aging over the course of 10 years? I think that red light can be beneficial. Do I think it's the most, if you guys saw my video last night on IG, I actually just went and got a facial, and part of that treatment was 15 minutes of red light therapy. I do think red light is something that is beneficial to include in your routine. I'm kind of bad about integrating devices in my routine. I'm kind of like bad about doing that, but that definitely can help. So yeah, and I never, that's the thing with any of my patients, doing cosmetics, any of my patients, I never want anyone to look overdone. I never want anyone to look like, augmented. I don't want anyone to make a big scene of the things they've had done. So, but that literally, if those blepharoplasties, they literally take 1 week to kind of heal from. I take the stitch out in a week. It's very, very easy. So we'll do so red light panel we talked about. Margaret, so thank you for being here, Margaret. By the way, my skin is oily and I use moisturizer, toner, and ampule with Centella, but I get dry patches on the cheeks. I don't know what to do about it. Yeah, it's always really tough when you've kind of got that mixed thing where you're dealing with some dry spots in some areas, and then in other areas you have a lot of oily skin. So you might consider just trying to moisturize the areas where you tend to get the dryness, in like the T-zone, or the area between your face, like the middle part of your face where you're going to get oily. In that case, maybe you don't sweat it, don't apply there. I think you're doing the right thing by moisturizing. They obviously make some mattifying moisturizers, things like doing the La Roche-Posay mattifying moisturizer. Another thing you can do is use like some of the mattifying sunscreens. So things like Supergoop matte screen, that's a good one. Best thing for blackheads. So Abreeze, thank you for being here, by the way. Really appreciate you. Best thing for blackheads. So blackheads are like open comedones. That's what they're called. Best ways to treat them are things like using adapalene at bedtime. That's the long solution. That's the way to reduce them over the long term and also to help remove them easier. So adapalene at bedtime makes your skin cells less sticky and it makes those pores less likely to get blocked up. So I would use that. And then the other best thing that you can do is use things like salicylic acid. And generally I would recommend a 2% salicylic acid. 2% salicylic acid is a really nice way. It's a type of beta hydroxy acid that kind of melts down into those oil glands and helps to kind of open up those. So that's the way to do it. Will Botox cause atrophy of the facial muscles and volume loss over time? So the areas that you treat, you don't really worry about a ton of volume. Generally the forehead, you don't worry about a ton of volume. Over here, really, you don't also worry about a ton of volume. So the areas that we treat with Botox most commonly, we're not really super worried about volume, but do those muscles relax and get a little bit thinner? They do. Now, as soon as Botox wears off and those muscles start moving again, just like if your arm was in a cast, that muscle pumps back up. So you got to think these are very, very thin muscles anyway. So there's not a ton of volume to lose. Like if your thigh was in a cast, you can lose a ton of muscle volume, but relatively muscles in your face are not super contributory to aging. So as your muscles really don't change that much, your fat pads change a lot, your skin gets more lax, and some of the tendons and ligaments in your face get more lax. And because of that, you can see changes of facial aging, but the muscles don't play a huge role in it actually. So Wander Nectar said, so that was the Botox question. Maddie asked, I just started Accutane. When will I start seeing side effects? So usually within the first month, you start to get kind of dry, but most people simply deal with dryness from that. Sometimes people get a little bit of extra muscle aches or joint pain, but that's the main thing that people see with Accutane. But usually within the first month, your lips are going to get pretty dry. If you're on Accutane, just make sure you're taking it with some fatty foods, so egg yolks or peanut butter or avocado, because you're going to absorb that medicine better. If you take it without food, sometimes people don't get the full dose of the medicine and it doesn't work quite as good. I think I just saw some, what is that familiar? What was the name there? Farmizzle, nice name by the way. Just did CO2, fractional CO2. Congratulations, a great treatment. I do erbium in my clinic, so it's a little different than CO2, but great results as well. So Nora says white patches on the skin of the forehead and the cheeks, mostly in the winter. So one of the most common reasons that we see little white patches on the cheeks like that is a very mild form of eczema that might also explain why you see it more in the winter. It's called Psoriasis alba. Hello, love. Hello, you want to come say hello? You cleaning. Psoriasis alba. So the key with that is you want to moisturize. So we're live on YouTube. I love YouTube and also on TikTok. Nice. Love. So this is my sweet wife. That's Christina. I love you, baby. No. So anyway, I have KP on my arms and no one has a cure. Right. So unfortunately, there is no cure for KP. There's only treatments to make it better. So doing things like amlactin and CeraVe SA cleanser and do those and rotate those things. Professional dermaplaning is very nice. It helps your skin absorb nicely. They said, hi, Christina. She's already back down. We have a couple family members coming downtown to see her baby. So I think she's kind of getting the house tuned up a little bit for them. So she's split. So Ibreeze, what's the little blood spots on my skin? Usually on my arms, they're like freckles, but red. They look like blood. So Ibreeze, that's a great question. Those are called cherry angiomas and they're autosomal dominant. So that meaning like if your parents have them, like one parent, you have a 50% chance of having them. I have a lot of those myself. They can actually easily be removed with a laser like BBL. So they're a really, really good treatment. That's a really good treatment for them overall. They're like freckles, but look like blood. They can be removed very easily. Muno says, I have a lot of weight on my fat pads disappear. I lost a lot of weight. Is filler an option or fat transfer? So all of these are options for you. You can do all kinds of things. You can do things like fat matrix, like Renuva. You can do Sculptra. You can do filler. Those are all good options for people that have lost some weight. A lot of those things are going to be things that are slower. They're going to be more natural. They're going to be more gradual. So that can all be done. My toenails are rotting. Wow. Oreos and milk. Breaking off, but won't actually fall off. I see both sides of the nail. So yeah, there could be a couple things going on. You could have nail psoriasis as a possibility, but more commonly, a lot of times people do people actually have nail fungus. So you can go into your dermatologist. They can take a small clipping of the nail. Myra, thanks for the follow, by the way. I appreciate it, Myra. They can take a small clipping of the nail, and they can put that either under the microscope or put it in basically a culture medium to grow fungus. And then if you do have fungus in those nails, you can get treated with 3 months of antifungals. And with those antifungals, Kim, McKeely, Rosie, and Missy, thank you for the follow. You guys are amazing. Thank you. So if you get treated with a fungus and you do that for a little while, that's going to be a great way to help, get that cleared up. Now, when you take that medicine, it actually takes 1 year for your nails to look normal, because you actually have to, once you get treated, you have to let those nails grow out to get completely cured. So Olivia says there's red around my nose, like acne, like bumps, but I'm not sure if it's truly acne or dry. So yeah, it's tough. That's an area where you can get acne, where you can get rosacea, or you can get a condition called seborrheic dermatitis. So it is kind of tough there, because you can get a lot of different things that happen. Most commonly, if you're just breaking out and you're not actually having whiteheads or blackheads, but more like pus bumps, it is kind of common to get things like rosacea there. Olivia, one thing that you might want to integrate into your skincare routine to kind of see how you do it, is I would see how it does for you is get like the ordinary azelaic acid, like a 15% azelaic acid, and just start doing that once or twice a day. And that might be a good way to help reduce that. So Aubrey says, I want to do dermaplaning for a while, but it's scared that the hair will grow back darker. It definitely will not grow back darker. So if you want to do the dermaplaning, shaving does not increase the thickness of the hair or make it grow back darker. If that was the case, then every guy would be shaving their scalps to get their hair to grow back thicker and fuller. So it's not a thing. So I don't know about fat transfers because I don't do them, but sometimes it takes multiple sessions with any of this stuff to kind of get the best results. So, but a lot of things I do, if I do sculpture, a lot of times I'll do a couple vials. That's probably about $1,600 a treatment. Or if I do a single vial, around $800 a treatment. Is it dangerous to apply retinoids over your eyelids too? I would really never do it on your upper eyelid, just because that's an area when your eyes are open, that's skin on skin contact, and it's going to make that more potent. It's going to make it really hard. There is some argument of, does it decrease the ability of the meibomian glands, which make oil production and like the fluid of our eye? So I really wouldn't put it real close to your eyelids. But if you're looking to use something that's a little bit more gentle, you could use the Brandify retinol eye serum. That would be something that's a little bit more mild and do. Roles of nurses in dermatology clinics, they help me during surgery. They help cut suture. They help blot blood. They help me close surgical wounds. They do room patients, get an idea of their of their chief concerns and how things are working for them. When we're doing Botox, they're like handing me the needles. When they're handing filler, they're taking the inserter needle. They're handing me the injections. So they're very like close up, hands on. During the laser procedures, they're using the smoke evacuator. They're blowing cold air on the patient's face to help them feel more comfortable. So a lot of those. Recommend laser hair removal for peach fuzz. So unfortunately, no, it's not going to help the peach fuzz, because peach fuzz is usually clear. Now there are lasers that will vaporize peach fuzz, like nano peels that I do in the office. Amber, thank you so much. And thank you so much for commenting on the glow. I really appreciate it, Amber. So there's some things that can, remove that. But overall, laser hair removal is not going to help with peach fuzz. Rinvoq or Dupixent, I always start with Dupixent first. Although Rinvoq is incredibly effective, I start with Dupixent because overall it's safer. So cutaneous T-cell lymphoma, you need to be seeing a dermatologist. You need to be seeing an expert in lymphoma. I treat patients with cutaneous lymphomas. There's a variety of treatments, but that's nothing that you can do anything on social media about. You're going to have to see a dermatologist in person. Side effects of Sculptra. The most common thing that can happen is a bruise from the needle poke. Back in the day when we used to do really highly concentrated Sculptra, sometimes people would get small bumps under the skin that are like little collagen nodules, little inflammatory nodules. That's less likely now with the new dilutions of Sculptra. Anytime you're poking the skin, there's obviously a risk of infection. And I believe there have been some people that have had blockages of blood vessels with Sculptra, although that is way, way less rare than with other fillers. That could happen. So, and it's more because the blood vessel gets injured and maybe you get like a little platelet kind of blockage there. But overall, it's a good treatment to do. You want to talk to your doctor in person about it. So I want to take a moment to pause again. I want to reintroduce myself. I'm Dr. Dylan Greeny. I definitely appreciate your guys subscribing. If you guys subscribe or follow, if you want to send a thank you, a sticker, a super, that's awesome. I appreciate you supporting the channel. The reason that I appreciate that is because it helps grow our community. I've literally been helping people get their best skin on social media for 4 or 5 years. I love doing these lives with you. It's literally my most favorite thing that I do on social media. So I really appreciate you guys being here. When you guys tap the screen, it supports the live. When you guys follow or support, like Alex and Joanne, you guys are amazing. LED lights do not cause cataracts, no. So when you guys follow, I really appreciate it. When you guys send the live to your friend, it helps also support the channel. So again, I'm Dr. Dylan Greeny. I'm a board certified dermatologist. I'm here to help you get your best skin. Make sure to keep dropping your questions in the chat. Make sure to invite your friends over for the live right now, because I'm here for you guys. So invite your friends, because I want to help them too. Tap the likes. If you're on YouTube, make sure to drop some thumbs up in the chat, spam the chat with some love. It really helps, like, the engagement. It helps get this community going. So thank you guys so much. It takes 12 years of training to become a dermatologist, and I treat over 3,000 conditions of the hair, skin, and nails. So I'm here to help you guys. So Muhammad had the questions, skin fungus is not recovering. So see a dermatologist. There's only limited. Hey, Danny, what's up? Thanks for being here. It's good to see you. So thanks for being here. So it's tough with skin fungus. The issue is, you want to make sure it's skin fungus for one. There's limited things that you can do over the counter. Sometimes you need to do more, and sometimes you need to do oral treatments, because if like fungus gets down in the hair follicles and stuff, you can't really treat it with topicals, because that fungus can hide in the hair follicles and you can only treat the skin. So other questions. So Goji says, is the best skincare regimen for 17-year-old with dry skin? So that skincare routine would be the same skincare routine that I recommended earlier. You want to use a great cleanser, CeraVe cream to foam cleanser. You want to use a great vitamin C. I would be using Brandify vitamin C. I would use a great sunscreen. I would be using Ulta-MD UV clear tinted sunscreen. And then at bedtime, I would be using La Roche-Posay adapalene. And then I would also be topping that off with a great CeraVe moisturizing lotion. So that's what I would be doing for a skincare routine at 17. So Mala says, that's true. He's the only one that literally helps without asking for anything. Best doctor. Well, thank you so much. I love helping you guys. I am the most accessible dermatologist on social media. I love answering you guys' questions. I'm literally here for you. It's wonderful. I am so blessed that my schedule, I can help patients in the office for 4 days a week. And then I have the weekend to help you guys and see you guys on Fridays. So this is incredible. And if I don't get your questions, you guys know you can just drop them on my videos. I answer all the comments on my videos. So barring a crazy viral video, that like on IG, I've got one that's at 5 million right now. Obviously hard to answer all those questions, but generally I answer every single question I get. Does mouth tape help with aging or silly? I'll tell you, I tried using mouth tape, one for just oral health, because I'm a mouth breather. You guys might be able to hear it in my voice, and maybe I'm a little nasally. But mouth tape, it's hard for me to sleep with like that. I tried training my nose. I think probably it's beneficial, but it just doesn't work for me. I can't do it. Skin looks good. What's your routine? I'm 38 years old. I have Botox on board right now. I had a chemical peel on Monday. I had a facial yesterday. So my skin's looking pretty fire right now. And but my routine, the things I talk to you guys about and tell you guys about, again, I always want it to be affordable and accessible and safe for you. The things I tell you are literally the same things that I do for myself. So I am not hiding or gatekeeping anything. I'm literally, the things I tell you are literally what I use. So have I tried out Zoryve? I definitely have. Some people have liked it and some people haven't. It just depends. I think it's a good option. Most overrated or commonly misused skincare products. Most people don't use like retinoids correctly. They mostly don't use retinoids correctly. They're spot treating. They're not using them enough. They're not sticking with the program to get used to them. The most overrated, so hard. What's the most overrated? Most overrated skincare. Trying to think what I don't really like. I always talk about what I like. I rarely talk about what I don't like. I'm gonna have to think about that one. I don't really know what like really the most overrated is. So Amber says the most only dermatology doesn't gatekeep, and you're always ready to help and suggest. Always really appreciate you. You're the best. Well, thank you so much. I appreciate Amber. You're awesome. And Margaret says I'm such a blessing. You guys are just too nice, man. And Shritha says good evening, sir. Well, good evening to you. It's morning where I'm at. It's 10:49 where I'm at. But thank you. We got people coming in from all over the world. We have most people here in the United States, but there's a lot of people all over the world. So I'm really, really thankful for all you guys. So Nora says thank you. I'm also a medical student, and I thank you so much and congratulations on becoming a medical student and working hard, because I know it's not an easy journey. Is it true that we can change our skin color without pain? I don't know about that, man. I don't know why anybody would want to change their skin color. But I hate to say it, but most when I talk about cosmetic procedures, I usually tell people there's like 3 taxes. There's the downtime tax, which is usually the hardest. Like people are worried about being wet, weepy, and dealing with wound care. There's the payment tax, which is actually the cost of the cosmetic procedure, and there's the pain tax. So usually we try to reduce the obviously the pain, you know, the pain tax the best we can. Finasteride is absolutely effective for hair loss, Bob. So finasteride is one of the most effective things for hair loss. That and minoxidil. It is definitely helpful. It's always easier to keep hair than regrow it though. Best serums for scars. The things I talk about, like vitamin C serum and adapalene. Your retinoids are going to be ways to help to form collagen and help the scars to look better. But procedural things are going to be the ones that that help the most with scarring. So is it really essential to use retinol? I finally got a routine that works for me after surgery for acne. I'm scared of adding on or changing anything. Well, James, retinol is one of the most proven. It's one of the most one of the most proven ingredients for anti-aging and skincare. So I definitely think that everybody should be including retinol in your routine. However, what I'll say is, if you're doing great with the routine you have, and you know, it's a good thing if it's not broke, don't fix it kind of situation. So don't feel like you have to add it in, but truly it is one of the most effective things. There's a lot of great retinols that are very gentle on your skin. Like the one from Brandify is very good. You can also get ROC, ROC. That's very good retinol as well. So thank you guys so much. Feel free to guys to subscribe and follow if you don't right now. Make sure to subscribe and follow if you don't right now. I really appreciate you guys being here. I'm Dr. Dylan Greeny. Finasteride, unfortunately, not really super trialed for acne. It's a good question because it does affect testosterone, which we know affects acne. Dermapen, best for scars. That can be helpful, especially with any skin type. But lasers can be incredibly helpful for scars too. What do you recommend for my granddaughter, 13? What can she use for face moisturizer and wash? I would use the CeraVe cream to foam cleanser. That would be a wonderful face wash for you or your 13-year-old granddaughter. Yilix, thanks so much. She's working in derm and she thinks it's great. Thank you so much. I love being here, guys. This is awesome. I love helping you guys. So thanks for being here. It's funny. There's a lot of people that end up working in dermatologists. We got a ton of nurses, in here. A lot of, derm nurses working in here, dermatologists. We see a lot of doctors that come through the chats, RN. This community is incredible. We got a community across the board. We're on YouTube vertical live right now. Love you guys over there. We're on TikTok right now. Over 7,000 viewers come through TikTok. So I appreciate all of you guys being here across the platforms. We do also have a Discord community. So the link in the bio, the link in my bio, you can get all my favorite skincare for different problems. So if you have the rough bumpy skin of KP, if you have worried about dark spots, if you want glowing skin, if you want a full skincare routine, literally at the link in my bio, I have all of that. You can also find my Discord community in there. Another thing you can get linked to is my actual website that shows the before and afters of my cosmetic results. So if you're interested in cosmetic medical procedures, you can click the link in my bio and go to SwolMD Skincare. And on there, I have great before and afters of all my patients. So you can check that out. TCA Cross for acne scars. They're very good for ice pick acne scarring. That's one of the best ways to treat it. I'm not really a great expert on the gray hair solutions. You see people doing it. You guys might want to look into Brian Johnson. I think he's got a supplement that he likes to use for graying hair. So you can check that out. Thank Thank you so much, Not a Dermatologist. I'm sure you probably participate in nearly all of them. You're probably, she's in so many of the derm communities, and it means a lot saying that this is one of her favorite communities. So yeah, we've got about 500 people on the Discord. You know, we were thriving a little bit more on there, but I've kind of been doing lives in other areas now. So yeah, so yeah, so thank you guys again for being here. So I really appreciate it. Tinea Versicolor at home remedy. So you want to use for Tinea Versicolor, you want to use Nizoral shampoo as a body wash. That's a really good way to do it. You can kind of use the Nizoral as a body wash. That's a really good option. You can email me. It says, yes, you're right, him, her. Feel free to email me if you want to. Courtney is on 200 of spironolactone. That's a pretty heavy duty dose. Use tretinoin, but still have lots of redness with acne. So if you're still dealing with acne, you might want to look into going the, looking at the Accutane, depending on what you're planning. Like, I don't know if you're trying to have a family right now, but Accutane can definitely help reduce that burden of acne, especially because you're kind of maxed out. And Patricia, you're welcome. Thanks for being here. Best kid-friendly moisturizer for an 8-year-old. I would just go for CeraVe moisturizing lotion in the pump top. CeraVe moisturizing lotion is wonderful. I think that face exercises, does it help the skin? I'm not really about it that much. You know, a lot of what we do in the muscle contractions of our face contribute to lines on our skin. So I don't know that that's super helpful, to be honest, for you. So yeah, I get how to get even tone all over the body with some creams. So it's kind of tough. I mean, using your alpha hydroxy acids, things like topicals faded would be a good thing you can do. They make some body treatments to help fade darkness on the body. So topicals faded is a very good one. So guys, let's drop some love in the chat. Feel free to drop some love in the chat if you guys are here. Spam some thumbs up, spam some fire emojis. If you guys are still here, let me know on YouTube if you guys are still here. Drop some fire emojis in the chat. I think we're kind of caught up on the chat there. I really appreciate you guys for being here. So thank you so much. Drop some fire emojis in the chat if you're here. Is moisturizer with retinol okay? It's totally fine. Yeah, you can do that. If you want to use a dedicated moisturizer, you can also do that as well. So that's totally fine. Any help with thin skin? For sure. I really like Versed Retinol body lotion. That's a very nice option. Or you can do the Gold Bond retinol body lotion, and over time that will help thicken up the skin. Another good option is doing like fractionated lasers like Fraxel or Halo. Those are good options that you can do as well. And Glenn, thanks for the follow. Christy, thank you so much for being the #1 viewer, by the way. Christy, you've been here more than anybody else, so I appreciate you being here. Christy, you're awesome. And thanks for the drop of the fire emojis. Thank you so much, the beautiful Silicon, for the hand heart. You're awesome. Thank you. I appreciate you. Margaret, thanks for dropping the fire. Radio frequency work for aging. Yeah, so RF you definitely can use for aging. I do incorporate radio frequency in my routine a few nights a week. I personally use the Amiro device. If you guys want to learn about it, you can check out the my full video on Amiro. I did a whole video on Amiro R3. So I would check that out if you guys want. That's a really good option overall for radio frequency. And I do that a few times a week. Zara, thanks for all the love. And Margaret, thanks for all the love. You guys are incredible. So this has been such a great live. Small pinpoint white dot on my lip. I was told it's a deposit. Can I pop it? So yeah, you can get little milia around the lips, and they can be popped and expressed, but also sometimes we do get some little oil glands there that are normal. Tips for eyelashes, they've stopped growing. My favorite option for that is there's an eyelash serum called Babe Original, and you can actually on my Instagram, if you go in my little stickers on my Instagram, I actually have a discount code for Babe Original. It's very good. You can also use things like Latisse, but Babe Original is the easy one you get over the counter. Zara, again, thanks so much for the fire, and such a pretty name too. So yeah, you guys are awesome. So thank you guys so much for being here. I think I'm going to shut it down, but make sure now is the time to tap the follow, tap the subscribe, guys. Tap the follow and tap the subscribe right now. If I didn't answer your questions today, and we answered a lot of them, make sure to drop it on my most recent video. Drop it on my most recent video. Doesn't matter if you're on YouTube, doesn't matter if you're on TikTok, drop it on my most recent video. If you're on Instagram, drop it on my most recent video, and I'll make sure to answer that question. Guys, turn on notifications. I beg you, turn the notifications on. Make sure you have those on, because on YouTube, like a very small portion of the subscribers have notifications on, and you guys miss this stuff. And I think this is the most valuable thing, because it's pretty rare to get to sit down for an hour literally with a dermatologist and just ask any question that you guys have. So make sure to follow on there, follow on everything, subscribe. Wander, thanks so much. I appreciate your guys' time and hanging out in the chat. Thank you so much. Brenda, thank you so much for following. I appreciate you guys so much. Again, I'm Dr. Dylan Greeny. I'm a board certified dermatologist. Glenn, you're very welcome, and thank you for hanging out. Make sure you guys follow. Thanks again for the subscribers. Thanks for the supers and the stickers. I appreciate you guys a bunch. It shows your love. It helps grow our community. We have the absolute best, and I literally am the most accessible dermatologist on social media. I'm here for you. I love you guys. I'm gonna go ahead and shut it down for now. I'll be back. By the way, I'm starting to try to do lives every weekend, guys. So that's why I want you guys to subscribe and follow. Eliza, thanks for following. I want you guys to subscribe and follow. I'm going to do these on the weekends in the morning, probably Saturdays or Sundays. I might do it a little earlier. I did it at 10 this morning. I might do it at 9 or 10 in the morning. Look out for it. I will schedule it. You guys will get the notification if you have notifications on. So thank you guys so much. You guys rock. Zahara, that is really bad news. I hate that it didn't send you the notification. You know, that's suspicious, right? But thank you guys so much. You guys rock. I want to get more into doing these more regularly, and I'll do it for you guys. So thank you so much. You guys are awesome. I'm going to shut it down. I appreciate you guys, and thank you. Thank you. You guys are the best. All right. Bye-bye now. We'll see you. Thank you guys so much. Thank you. Thank you. Thank you. Thank you. Appreciate you. Thank you.